Let's discuss the bony anatomy of the vertebral column. The vertebral column, from top to bottom, consists of several areas. We have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, we have the sacrum, and the coccyx or tailbone. Now, there are several characteristic curvatures of the vertebral column. The sacrum is convex towards the back. The lumbar region is concave. We use a term called lordosis, which refers to the curvature or sometimes an exaggeration of the curvature in this area. We have the convex thoracic region, also referred to as a kyphosis, and then we have the concave cervical region. Let's discuss the structure of the vertebrae. Now, each vertebra consists of 2 main parts. There's a body anterior, and the posterior section is referred to as the vertebral arch. Now, the vertebral body is roughly cylindrical and consists of 6 surfaces. The vertebral arch can be divided into many parts. It is connected to the body by 2 pedicles. It has 2 lamina posteriorly that unite to form the spinous process. Now, the thickened junctions between the pedicles and lamina have superior, inferior cartilaginous articular facets in this area here, and laterally projecting transverse processes, such as this one. The opening between the body and the arch is called the vertebral foramen. Foramina of many vertebrae line up and form the vertebral canal, through which the spinal cord passes. Now, the vertebral holes stacked on top of each other form a bony pipe, and this is the spinal canal through which the spinal cord passes. The spaces between the pedicles of adjacent vertebrae form a series of openings called the intervertebral foramina, which you can see here and here, for example. As the spinal nerves branch off the spinal cord, they exit through these foramina. You can see the spinal nerves here. Each vertebra is attached to its neighbor by 3 joints. Anteriorly, the bodies are joined by the fibrocartilaginous intervertebral disc, such as this disc here. Posteriorly, between the articular processes of the vertebrae, are the zygapophyseal joints. The 2 inferior articular facets of the top vertebra contact the 2 superior articular facets of the bottom vertebra. These facets are small and serve mainly to guide movements. They're also covered with cartilage and are held together by a capsule. Now, in cross-section, if we were to cut through the vertebra, we could see that the disc contains 2 distinct types of material. The peripheral area is called the annulus fibrosus. It's composed of concentric rings of fibrocartilage, arranged much like the layers of an onion. The central nucleus, if we were to cut through here and visualize the center of the disc, is made of a gelatinous substance. Besides allowing for movement between the vertebrae, the discs also act as shock absorbers and weight bearers. Let's talk about a few ligaments of the vertebral column. Now, running along the anterior aspect of the vertebral column, we have the anterior longitudinal ligament that attaches to the vertebral bodies on the front. And it acts as a brake in extension. So we'll have Mickey demonstrate extension here, spinal extension. So you can visualize that ligament on the front acting as a brake. Now, if we look at the back of the spine, we have 2 ligaments. We have the posterior longitudinal ligament running along the posterior bodies of the spine, as well as the supraspinous ligament, which runs from the SPs all along the back. Now, both those ligaments act as brakes in flexion. So we'll demonstrate flexion here. So visualize once again that ligament, both ligaments running along the back, acting as a brake in flexion. Now, an interesting point here is that the posterior longitudinal ligament also acts to absorb the displacement of the nuclei from within the disc. So as that nuclei moves posterior, the ligament actually absorbs that motion. Let's discuss the pelvis, or pelvic girdle. Now, pelvis means basin. It's a ring-shaped structure consisting of 4 main bones. We have the sacrum, the hip bones on either side, and then we have the coccyx. Now, the shape of the bones forms a greater or false pelvis at the top, while the shape of the bones forms a lesser or true pelvis at the bottom. The top opening of this lesser pelvis region is called the pelvic inlet. If we were to look from the bottom up through the opening, the bottom opening is called the pelvic outlet. Now, the hip bones in an adult consist of 3 bones that are fused together. We have the ilium, the ischium, and the pubis. Let's discuss the lateral surface of the hip bone. Before we start, just to be oriented in terms of where we are, this would be the ilium here. We have the femur, as you can see, articulating with the joint space, and posteriorly we have the coccyx and the sacrum. Now, if we look at the superior border here, this is known as the iliac crest. Looking at this surface here, you'll note that it's concave from bottom to top, and this is known as the external iliac fossa. Going a little further down, in the middle of the bone here is an area which forms a hollow sphere, and this is known as the acetabulum, and it receives the head of the femur, and this is where the articulation takes place. If we look posteriorly, we'll just rotate this back. This area here is known as the ischium. Rotating the pelvis slightly anterior now. The lower part of the hip bone here forms a bony arch, which we can see back here. There's a hole here known as the obturator foramen. The anterior region here is known as the pubis, and between the pubis and the ischium here, we have the ischiopubic ramus. Now, if we look at the anterior border of the ilium, there's a number of depressions and protuberances. The key ones being, we have the anterior superior iliac spine, which is the most forward part of the iliac crest. We have the anterior inferior iliac spine. And then here at the front, we would have the pubic tubercle. Seen from a 3/4 posterior view, we can visualize the posterior borders of the hip bone. And as you can see, there's various protuberances and depressions. Now the key ones being, we have the posterior superior iliac spine. Moving inferiorly, we have the posterior inferior iliac spine. Then we have the greater sciatic notch, followed by the ischial spine. Then we have the lesser sciatic notch, and lastly, the ischial tuberosity. Now, this is the part of the bone that you actually sit on and is commonly referred to as the sit bone. Looking at the hip bones from the front, we're going to pay particular attention to the medial surface. Now here we have the internal iliac fossa, an oblique crest here known as the iliopectineal line, and this forms the border between the lesser and greater pelvis. The internal circumference of the obturator foramen, which, let me rotate the pelvis slightly here, would be in this area. And I'm bringing it back. Now, there's an articular surface that's located in front of the pelvis, and this is a shape, it's an oval-shaped structure covered by cartilage, and this unites the 2 pubic bones, and this is the pubic symphyseal surface. Now, the articulation between the 2 pubic bones is called the pubic symphysis, and between the 2 surfaces is a fibrocartilaginous disc which attaches to the articular surfaces between these 2 bones. The entire structure is covered by a fibrous cuff, and this is reinforced by 4 ligaments. We would have an anterior, a posterior, superior, and inferior ligament. Now this joint has very little mobility. There's a bit of gliding that occurs, compression, and twisting movements are also possible here. The key point being that during childbirth, this joint loosens so that the pelvis can open further, allowing for delivery of the baby. Now we've turned the skeleton around so we can see the posterior aspect of the sacrum. As you can see, it's convex in its shape and the surface is much rougher than the anterior aspect of the sacrum. The posterior sacral foramina, which are visualized here, are continuous with the anterior foramina, and the posterior branches of the nerves exit here, that being the sacral nerves. If we look further down, there's a triangular shaped bone, which is the coccyx, and this is basically made up of 3 to 5 vertebrae that are fused together, and it's really difficult. You really can't tell them apart. Now the coccyx articulates with the sacrum via an oval-shaped surface, and it is supported by a capsule as well as ligaments, and these structures are often fused. Let's discuss the sacroiliac joint. Now the joint space is in here between the ilium and the sacrum, and you can see it on the opposite side as well. So these would be the two SI or sacroiliac joints. The joint consists of 2 auricular-shaped surfaces on top of the ilium and the sacrum. The auricular surface of the hip bone here is slightly convex, while the auricular surface of the sacrum is slightly concave. This arrangement allows for an important movement between the sacrum and the 2 ilia, so one ilia here, the other there, which is known as nutation and counternutation. Let's take a look at nutation first. Now, during nutation, the sacral base, and I'm going to use my hand here to represent the sacrum, would tilt anterior inferiorly. As that occurs, the sacral apex here would tilt posterior superiorly. There's one particular movement that we'll call sacral adduction, which involves the pelvis and the sacrum going into nutation, while the iliac wings are pulled medially and the ischial tuberosities move laterally. And I'll demonstrate here. So as this were to tilt forward into nutation, the top part here, the iliac wings, would actually move medially. And you can imagine looking inferiorly here that the 2 ischial tuberosities would actually move apart laterally. So during adduction of the pelvis, the diameter of the pelvic outlet here would increase, while the pelvic inlet superiorly would decrease from front to back. And this is an important movement that would allow delivery of a baby during childbirth. In the opposite movement, which we call pelvic abduction or abduction, the sacrum would move into counternutation, so it would be moving posteriorly. As the sacral base tilts backwards and upward, the sacral apex down here would actually tilt forward and downward, while the iliac wings on either side actually move away from the midline, and the ischial bones down here would actually move closer together. So during pelvic abduction, the pelvic inlet becomes larger, while the pelvic outlet down here becomes smaller. Let's discuss the sacroiliac ligaments. Now, each sacroiliac joint or SI joint is reinforced by a capsule and a strong network of ligaments. Inferiorly, the sacrospinous and sacrotuberous ligaments connect the sacrum to the ischial spine and ischial tuberosity respectively. So the first, being the sacrospinous ligament, would come off the lateral aspect of the sacrum and attach in to the ischial spine. So the ligament would run at this angle. Now, a little more inferiorly, we would have the sacrotuberous ligament coming off the lateral aspect of the sacrum, running slightly more inferior and attaching into the ischial tuberosity. These 2 ligaments, here and here, oppose adduction of the pelvis. There's also a series of ligaments on the posterior surface of the sacroiliac joint here, known as the posterior sacroiliac ligaments. And they connect the ilium here to the lateral sacral crest. These tend to oppose abduction of the pelvis. Let's discuss the lumbar spine. Now, the lumbar vertebrae are large, and they become larger as we move from top towards the bottom. You can see the discs are quite thick, and they're about 1/3 the thickness of the vertebral bodies. And this helps to increase mobility of the spine in this region. Now, the bodies of the vertebrae are large and shaped like a lima bean. Looking at the posterior aspect, if you were to look from top to bottom, you'd see that they're concave posteriorly. The transverse processes are long and have distinct tubercles on the front end, which serve for muscle attachment sites. There are iliolumbar ligaments that connect the transverse processes of L5 to the iliac crest and L4 to the iliac crest. Now, these ligaments oppose side bending. If we were to look at this from the side, you could see that the ligament from L4 is oriented posterior inferiorly, while the ligament from L5 runs more anterior inferiorly. Thus, the L4 ligament is stretched and the L5 ligament is relaxed during flexion, while the reverse occurs during extension. Let's discuss the thoracic spine. Now, the thoracic spine articulates with the ribs. It consists of 12 vertebrae, the thoracic vertebrae. Now, in contrast to the lumbar region, the thickness of the discs is only about 1/6 that of the bodies. So this tends to make the range of motion more limited in this area of the spine. The bodies of the thoracic vertebrae are more cylindrical in shape and almost round in cross-section. There are posterior facets on the bodies for articulation with the heads of the ribs. The T1 vertebrae has a facet near the top and an inferior facet. T2 through T9 each have superior and inferior facets, and T10 through T12 each have one facet. Looking at the thoracic spine from the posterior aspect, the vertebral attachments to the ribs here tend to limit thoracic mobility, making this quite stiff. The thoracic spine being the first thoracic vertebra, T1, all the way down to T12. Ribs 1 through 7 in this area are known as true ribs and actually attach anteriorly to the sternum via short cartilaginous structures which restrict mobility. Let's take a look at the thoracic cage. Now, the thoracic cage consists of the thoracic vertebrae at the back, ribs and sternum at the front. Now, the sternum is a flat bone. It's located at the front of the thorax, and it consists of 3 parts. The manubrium is the top part of the sternum, and this articulates with the clavicles on either side. This space here is known as the clavicular notch, and this depression at the top is known as the jugular notch. Now, the body of the sternum has lateral edges that articulate with the first 7 costal cartilages. And the most inferior tip of the sternum is known as the xiphoid process down here. Looking at the ribs are curved, flattened, and twisted bones. Each rib consists of a posterior end that has 3 parts, a head, neck, and tubercle, while the body of the rib comes anterior and actually articulates with the costal cartilage, as can be seen here. Most ribs articulate with 2 thoracic vertebrae at 3 points. The 2 facets on the head of the rib contact the vertebral bodies, and the tubercle of the rib contacts the transverse process. Each joint is stabilized by numerous small ligaments. Now, anteriorly, each rib is attached to the sternum via the costal cartilage. This increases the elasticity of the thoracic cage. The first 7 ribs are attached directly into the sternum, and these ribs are called true ribs, while the 3 following cartilages, more inferiorly here, all attached to the 7th rib. These are called false ribs, and have greater mobility. Now, the two lowest ribs do not have a cartilage. These are called floating ribs. Let's discuss the cervical spine. Now, the cervical spine forms the skeleton of the neck, and we can divide it into two regions. There's the suboccipital region of the cervical spine. It consists of the two top vertebrae, C1, the atlas, and C2, the axis. Looking at the lower cervical vertebrae, C3, all the way down to C7, these vertebrae have similar characteristics and function differently than the top two vertebrae, which we'll discuss later. If we look at the cervical vertebrae, the bodies of the vertebrae are small, and the discs, we could look at this disc here, are about 1/3 as thick as the bodies of the vertebrae. So both of these factors tend to increase the mobility of the cervical spine. Side bending is somewhat restricted by the rectangular shape of the bodies, which you could see in cross-section. Now, the superior surfaces of the cervical vertebral bodies project upward on the sides, and these projections, which you can see in this space right here, are known as the uncinate processes. The inferior surfaces are shaped to articulate with the superior ones. Now, the bony configuration provides mobility as well as stability. So vertebral bodies are stacked laterally. Now, if we rotate the spine here so we can see the posterior aspect, you can see that the length of the spinous processes in the cervical spine vary. Those in the middle region are short, especially C4, and this allows for good extension of the cervical spine. However, as we look lower at the bottom of the cervical spine, especially in the area of C6 and 7, extension would be more limited because of the length of these two spinous processes. They tend to restrain extension. The suboccipital spine is the top part of the cervical spine. Now, this is the area where movements that are independent of the head are made. Movements such as nodding the head yes or shaking it no. This area consists of two unique vertebrae, the atlas C1 and the axis C2. Now, C2, the axis, would be the first vertebrae that you could palpate with your hands when palpating the spine. If we look at the atlas C1, this is the first vertebra at the top of the spine, and it's not shaped like any other vertebra. It's essentially a bony ring reinforced by two strong lateral masses on either side. In the back, the posterior arch of the atlas here has no spinous process, whereas in the front, it has an anterior arch that forms the anterior aspect of the atlas, which has no vertebral body. Now, the large transverse processes of the atlas project from the sides, and they contain the transverse foramina, which the vertebral artery, which you can see here, passes through. The transverse ligament of the atlas, which attaches to the inside of the lateral masses, divides the ring of the atlas into two parts. The anterior part surrounds the dens of the axis, the C2 vertebrae, and the posterior part contains the vertebral foramen, which the spinal cord passes through. Now, the upper and lower surfaces of the lateral masses of the atlas have facets for articulation with the suboccipital condyle at the top in this region. Now, if we look at the occipital bone, we're going to tilt our skeleton forward slightly. The occipital bone is the posterior inferior part of the skull. This opening here is known as the foramen magnum. It's a large hole through which the spinal cord passes in order to merge with the brain. On each side of the hole are the occipital condyles, which you could kind of see here and here. And these are oval and convex surfaces that are covered with cartilage. And they articulate with the corresponding superior facets of the C1 or atlas vertebrae. The facets on the atlas are concave in contrast. Let's discuss the axis, or C2, and its connection to the atlas, or C1. Now, the axis is the second cervical vertebrae, and like the other cervical vertebrae, it has a typical shape, except that on the top of the C2 vertebrae, there are certain bony particularities which help it to articulate with the atlas. Now, each side of the vertebral body of C2 has a convex surface that articulates with the lateral facet of the atlas, or C1, above. The vertebral body of C2 has a peg-like process. This is called the dens, or odontoid process, and it's shaped like a pin. It's lodged in the anterior part of the ring-like structure of C1. Therefore, there's no disc between the atlas and the axis, just two free movable joints. The articular surfaces of C1 and C2 are convex. They don't fit into each other, so it's almost as a hinge that has permanent mobility. Now, there are two articulations between the atlas, C1, and the dens of C2. The dens fits anteriorly against the anterior arch of C1 and posteriorly against an articular surface of the transverse ligament of C1. Therefore, this pivot joint between C1 and 2 consists of a ring-like structure covered by cartilage that allows for rotation of the dens.